Hello, dear viewers. Welcome back to another. Hello, dear viewers. Welcome back to another episode of Medcast KGMA. Today we have got a guest with us who has 15 years of experience when it comes to TB. She is currently working in KGMA TB department. We have got with us Dr. Aimgul. How are you, ma'am?
Hello, I am very well, thank you.
So, ma'am, let's start with a brief introduction of you, your working experience, and specifically in the TB.
All right. I work in the TB field, most probably more than 15 years. Before I work as a general physician, and then I find the tuberculosis quite interesting for me, and then I switched to tuberculosis. So I work with the Doctors Without Borders, or MSF, well-known MSF, in the penitentiary system in Bishkek, in Kyrgyzstan, for 6 years, and then I also work with the Doctors Without Borders abroad in West Africa, in Sierra Leone, in the TB department. And also I work here in Bishkek in other NGOs dedicated to fight against tuberculosis. And now here I am. I retire, and I decided to work in KGMA as a teacher to share my knowledge, what I gain with the students and also with the people who are working around me.
Okay, ma'am, that's why we have called you here, because of the experience you have got internationally. Obviously, we'll discuss about the situation of TB in Kyrgyzstan as compared to the world. But let's start about TB, tuberculosis. First of all, the basic information for the viewers, those who do not know about TB. What exactly is TB? And then we will specifically discuss the MDR.
Yeah, thank you. Tuberculosis is the airborne disease which is spreading through the air. It is almost the same way of the spreading as COVID-19, as we all had the experience during the pandemic of COVID-19. It is mostly affect lungs. Therefore, it is spreadable when the person is coughing, sneezing, even singing. It also can bring the risk of getting TB with the health person. It also affects other organs. It also affects the other organs except lungs. All parts of the body could be affected. Bones, skin, the intestines, urogenital organs. Overall, you can say the whole body, except nails and might be hair.
Yeah. So, ma'am, now the basic concern topic, which is the drug resistance TB. First of all, what exactly is the drug resistance, and why TB is drug resistant? And what is MDR and XDR, obviously?
Well, the drug-resistant tuberculosis is the major threat to the public community. Why? Because the strains of tuberculosis will be not responding to the usual treatment which we usually treat. So there are drugs which commonly used for treatment of tuberculosis, and if there are some reasons why the drug resistance developed, it's due to the misuse of the drugs. Adherence is the problem. So the patient cannot finish the started treatment. The second one is wrong dosages, wrong combination of the drugs. All these factors could lead to the development of the drug-resistant TB. And also the person can be infected by the drug-resistant strain already for the first exposure. So the person who have TB, MDR-TB, can spread to the healthy person directly MDR-TB strain. So this is also the problem.
So, ma'am, how serious is the global threat of drug resistance TB in the world, and obviously in the Kyrgyzstan and in Bishkek specifically?
It is quite serious. Why? Because we cannot treat the extensively drug-resistant tuberculosis because we don't have range of the drugs which is effective for the treatment of this type. So we are losing drug by drug because these drugs are not effective for the treatment of such strains. And also cost-wise, it is quite costly. And also for the patient side, it is difficult to go through the long treatment. And these drugs are very strong antibiotics, and they are also toxic. So they have the adverse drug reactions on the body, which could affect, which could treat TB, but could affect the other organs such as liver, kidneys, heart could be affected. So all these factors could is difficult, to follow the treatment to the end. And the patient, if he has adverse drug reactions and is not good managed, then the person can give up the treatment. And it will lead to further spread of the infection to the other people. And also, it could cause the death.
We just talked about the treatment. Obviously, we know that the treatment is of very long duration. First of all, how important is to adhere to that treatment? And what if a patient misses few of his doses?
Well, life is life. So people turn to think, if I feel well, so I can stop the treatment. Yeah, which is happening with tuberculosis. People, when they are on the treatment, when they start treatment, they see the improvement very, very rapidly. So they gain weight, they have appetite, they can, the cough will stop, so they can have the normal life. And they think, okay, I'm cured. But what is very dangerous, I would say, with TB, so the person feel healthy, but TB is still there. The bacteria is still alive. So he can still spread the infection. Yeah. And this infection, it just weaken due to the effect of these drugs. And then the person say, okay, I give up the treatment, which is wrong. Yeah. So what we have to do, we have to educate the patients that the treatment is from the beginning. The treatment duration is so. So you have to follow the treatment regimen. If you miss doses, okay, you will not take additional doses because you missed, you have to continue. Yeah, even in the WHO guideline, there is a message, if the person till the 2 months of the treatment will not return to the treatment, then we can put the outcome. If before, so we can still continue treatment, but we can add the missed doses to the length of the treatment. So the patient will continue till the end.
All right. So coming back to the topic, what are the difficulties faced in the treatment of MDR-TB? And what are the actually barriers because when it comes to treating MDR, the Kyrgyzstan's ratio in treating MDR for new treatment cases, it is 74%. Which according to WHO guidelines is obviously less, because WHO guidelines says it has to be 85% at least. And obviously another major concern is the retreatment. So that ratio falls down to 44%, which is a point of concern.
Yeah, you're right, saying that the treatment outcome of the retreatment cases lower than the new cases. It is why? Because the retreatment cases already have exposure before, and they have a treatment before, and they already had take the drugs, which is going to be the same on the second regimen. Yeah, and then we can expect that such cases are develop another resistance to another drugs, or the same drugs which he was taking it. Yeah, so we could speak about the acquired drug resistance. So in addition of the previous drug resistance, then there will be a new drug resistant appear. Therefore, these patients turn to have to fail the treatment, right? Therefore, the outcome, the successful outcome is lower. The second point why it is difficult to treat, it is due to the drugs, second-line drugs, and the other drugs. They are less effective than the first-line drugs, I would say. They are less strong. They are not so strong as first-line drugs. Therefore, we have to give them more than 4 drugs, sometimes 5 or sometimes 6 drugs in one regimen. And also they have adverse drug reactions or side effects. Yeah. So some people, they just see the drugs, just the appearance of the drugs, and they start, feeling nausea or vomiting, even on the distance. So therefore, it gives the barrier to, to finish them to the end. So they just cannot tolerate it. Yeah. Therefore, we need to counsel, we need to explain to the people that this is the option you have. Then you can have your resistance can be extensively drug-resistant TB, which is very, very hard to cure.
Ma'am, I actually read somewhere that out of all cases of TB in Kyrgyzstan, there are 45% cases of migrants, if I'm not wrong. First of all, migrants, how much important they are in, not exactly important, but how much are they involved in the spread of TB in specific region? And the second question is going to be that their cases, more or less, according to the data, are gone unnoticed.
Well, for sure, the migrants are a high-risk group of the getting tuberculosis. We have migrants coming from the Russia. We have migrants coming from the India, Pakistan, Bangladesh, and we don't have the system to check all the people who are coming to the country, like entrance and to make at least chest X-ray to see if they have TB or they don't have TB. And the living condition of the migrants, for sure, sometimes they have poor living condition. Yeah, in one room might be many people living, or the food which they have might be not enough. So they are in the list of the high risk groups, the migrants. What else you asked me about the migrants?
It was the question was about the migrants. First of all, what measures can be taken to take that over, and because those cases, even if they are TB, they have TB, they gone unnoticed.
Oh, well,
a major ratio of the migrants is those cases which are unnoticed.
We don't know how many of such cases in the community, to be honest. But in our country, everybody are free to go to the medical center, to the FMCs, to family medical centers, or family group of the family doctors in the place where they live. Might be some people don't know that, but they do. They can go there, even if they are not a citizen of our country. They have to pay some insurance. But first of all, they have to go first to the medical doctor to check, and if they have TB, they have to pay for the insurance for the I don't know the amount, I don't remember. So, and then they get free treatment. So probably some people don't know about that.
Yeah.
So they don't go. They try to, or maybe they don't know even the symptoms of TB. If they are coughing and they say, okay, I'm just have flu, and they take antibiotics by themselves, and it could be like that.
Yeah, that's the point of concern, because awareness, how much is it important that they should actually visit the FMCs, And the second most important thing, as much as I think, is that screening process. Should there be any screening process just in case if there are migrants or even they are the citizens of the Kyrgyz Republic? They should have chest X-rays. They should have screening process.
You know
for
what
this.
happened in 2024? There was a screening, mass screening was organized by the CTTB hospital with the digital X-ray, with the artificial intelligence, which is, I believe, should detect many people. But what happened in the places? In fact, when the radiologist comes to the place, it is not organized, so people don't know. They was not aware that there is a mass screening is happening. It is free of charge. You can get the image straight away where you take the image. So it's, I would say, somehow it failed, yeah, but it was a big campaign. So all the 2024 year, the machine was going in one place to another place and making the screenings. Some people benefited from it, and they were detected some cases, not only TB, cancer or chronic pulmonary diseases, any respiratory diseases could be detected by the artificial chest X-ray, and then they refer to the further investigation. Chest X-ray was like a screening tool, yeah, and for the migrants, it would work if on entrance they would have the chest X-ray. We had this crazy idea to put the chest X-ray on the airport, but it's crazy idea. But it would be.
It's a good option, is it?
It would work. For instance, we don't know which people are coming from. For instance, India, not only students, right?
Yeah.
Well, probably the workers who wants to work in the sewing companies or whatever, or this global food carriage.
Yeah.
Well, and we don't know. Do we have rights to do so? Yeah, it's humiliation of the rights. The person is coming.
Basic
and then
rights.
You force him to make a chest X-ray. Well, there are so many things behind. Idea is idea, but to implement it is quite difficult.
Yeah.
And people can say, "Why are you taking me? Why are you doing that? I am not. I don't give my consent." And he'll be right. Yeah.
Yeah.
In the way he will be right.
Yeah. So, MDR, obviously it is concerned with the patients who've been already diagnosed with the TB and they have the drug resistance, now, because as much as I know, according to USAID, Kyrgyzstan stays at the 6th place when it comes to MDR ratio of the cases, and it is among the 18 countries in the European region when it comes to multidrug-resistant TB. So the policy making specifically for multidrug resistance, because as we have already discussed, the regular TB, the treatment ratio is quite well. If not up to the mark, it is quite well. But MDR ratio is quite low. So
when we speak about the overall the problem of tuberculosis, not only MDR-TB. So the problem is there are so many undetected cases in the community. For instance, if we have estimated TB incidence, which is estimation, it's not real, it is 112 per 100,000 population.
All right.
And the real data is 60. So half 60 to 100,000 population, meaning so we are missing every second person.
So 50% is
we are not detecting them. Yeah, and that is the major problem. Therefore, the chest X-rays with the digital with artificial intelligence was purchased in order to find all the missing cases.
Yeah.
And also we have so many good movement in terms of the treatment of MDR-TB. So we have shortened treatment regimen, which is consists of bedaquiline, pritamanate, linezolid, which is giving for 6-9 months, compare the 2 years longer treatment regimen. So the drugs are here. So the policy is here. The implementation is already also here. The National TB program is very supportive. Yeah. What is missing? It is, I would say,
Public awareness.
Engagement of the civil society engagement. Yeah, because there are some ways to support people with the treatment when they go out from the hospital. It is community support treatment. So the people can organize direct labs of treatment at home. Yeah. Also we also implemented tool like video control treatment. By the video, the person can be at work or can be at home. Then they can show that they are taking the drugs. So the shorter treatment regimen is available. We also have a very good new tool implemented, which is Oxford Nanopore sequencing machine, which can be used in the peripheral level. So we have gene expert, which are in FMCs, and we also can have MinION machine manufactured by Oxford Nanopore. It is detecting not only Mycobacterium tuberculosis, but also detect the resistance to foreign drugs. It has availability of that. And it is also detecting in the short period of time, at least 2 days, 4 days, we can receive the results. So all these efforts are making in our country, but still we are not getting there. Yeah.
So we discussed the role of the state. As much as the role of state is concerned, it has been done quite in the good manner. But how important is the role of social media and the role of communities, obviously role of NGOs, private bodies for spreading that awareness that first of all they should stick to that treatment, and obviously in detecting the cases, just in case they should not leave that off.
I see the role of the non-governmental organization in the rising awareness.
Yeah.
So people have to know what is the symptoms, where to go, what kind of if I have treatment, so how long my treatment would be. Sometimes they feel shy asking doctor, but the community healthcare worker could explain and could help with that. It's quite crucial, the collaboration between the governmental and the non-governmental organization, and also civil societies. We can see the many examples from South Africa, for instance. In India, they have very good national TB program together with the NGOs. And there was a public awareness campaigns when in India they involve rich people to help with the food to the TB patients. And I think they call it Nikshai something. So they enroll to the program and they follow the patients from the beginning of the treatment till the end. So there are so many examples of the good handling of the the problem.
So okay, ma'am, we discussed about some modern ways of treatment, where we discussed about the short treatment plan. First of all, how much effective that short treatment plan is as compared to the original treatment plan, and what measures should be taken to reach that level of success ratio when it comes to treatment?
Well, the newest regimens show the quite good effectiveness due to less toxic, due to the less duration. The acceptance of the patients accepted this treatment quite well. When we start treatment, people were scared because it's new drugs, new regimen, so how it could be, etc. But when the first patients get cured, so the popularity of this regimen increase, and but they still some medical doctors still has hesitating. How come only 3 drugs? We have 8 drugs before and 2 years, but now only 3 drugs and 9 months. How come? So it's also difficult.
Yeah.
I can understand them, and I also from them. Yeah, I was like, how come could be? But when we start treatment and when we see the outcomes, so we believe and I trust to this regimen that it is quite effective on the patients.
Yeah. So this thing just came into my mind. How much important is the role of those patients who have been cured from TB? Because as we discussed, that the drugs which are being used for the TB, they can have some side effects, and countries where the literacy rate is low, they can actually leave their treatment plan just because they are having some side effects.
Mm-hmm.
So how much important is the role of those patients?
Well, during when we start working with bedaquiline, so there was very good support from the patients who are adhering to the treatment, and we ask them if they can help us to speak to other patients, and it worked very well. And we also have people, I would say, not the patients, who already cured, and they were helping us in the public awareness campaign. So they explaining, to other people that yes, there are some side effects, but you have to report because it could be, it's treatable. Don't hide it and don't give up the treatment. So you have to go to the end. So they are quite helpful, to be honest. And some of them, they work with us. We in KNCV, in the second in the NGO where I work, and they are still with us, and we are following them, and some they have a good career, so we are happy for them. Yeah.
We have discussed about the treatment. I mean, prevention is, as we have all heard, that prevention is better than treatment. At the prevention level, how much near we are to prevent it exactly from the spread or from those regions? Are there any new vaccines which can prevent from TB?
Oh, thank you for these questions. Yeah. So globally, there is a clinical trials are going on the new TB vaccines. There are different types of the TB vaccines. As you know, we have only one BCG vaccine, which is more than 100 years old, but we are still using worldwide. And now there are new development of the BCG vaccine booster for the adults, and also the same mechanism as BCG produced, the same vaccines. So there are different. Another vaccine is M75, which is already had a clinical trial in South Africa and shows 46% of the effectiveness, which is quite good.
Yeah.
But still it is going on, the trial, and it is in adults, those who have latent TB infection. There is another vaccine which is Bill and Melinda Gates Foundation funded, also on the, I think, clinical phase 3 is already there. I don't remember the name because they are within some numbers. So there are very good development is going on. And another vaccine, like we have COVID-19 vaccine, mRNA vaccine. It's also the same mechanism, mRNA from, I think, Johnson & Johnson. They are also doing the clinical trials. So there are big movement going on. We hope that in 2028, one of the vaccine will be released and will be, we hope that we will have it. But I don't know yet. But still, we have only BCG vaccine. which is protecting children from the severe forms of the tuberculosis. No vaccine for adults. Yeah,
All right.
no,
So,
no.
what's the progress of Kyrgyzstan when it comes to newly developed treatment methods and like preventive methods as compared to the first world countries?
Well, the guidelines is there. So to prevent the usually we have who first of all who supposed to have the preventive treatment. Yeah, so people who are in contact first of all. For instance, family members of the person who is sick with TB. So of course you have to rule out from the active TB from this person and then to prescribe the regimen. There are available treatment regimen for the prevention of drug-resistant tuberculosis in the world, in the guidelines, in the WHO guidelines. My country already put in the guidelines the regimen, but still is not used yet. Yeah, unfortunately. But for the drug-susceptible TB, we use isoniazid.
All right. So, coming towards the end of the podcast, what measures should be taken, and what can actually the Kyrgyz Republic learn from those countries who have taken over or who have 0% TB cases? Or just
Yeah. Well, there are so many. First of all, the straighten the political policy against tuberculosis. Then capacity of the primary healthcare workers, engagement of private healthcare facilities to the management of tuberculosis. Then infection control measures should be taken seriously in the all levels, especially in the primary healthcare level, because in the primary healthcare level we always forget about the infection control measures.
Yeah.
In TB facility, yes, because we all know these TB patients, so we protect, and the facility also designed to protect people who are working inside, but not the primary healthcare. What else? Good supply chain of the drugs, quality of the drugs, quality of the laboratory. So the laboratory should have a good capacity to make to perform a drug susceptibility testing. Also to accept the innovations such as Oxford nanopore sequencing or target sequencing or full genome sequencing, and implement them, use them despite of having other diagnostic tools. So use the artificial intelligence. Why not?
Yeah.
It is all
Need of
all
time.
aware. Yeah.
Thank you so much, ma'am, for being on the set. It was very interesting to discuss, and I hope we created an impact. At last, what is your message to our audience, and how can they help us in spreading the awareness about the TB?
Well, what I would say, don't scare of TB. TB is curable. Yeah, be healthy. Keep your health so have a healthy lifestyle, I would say. Don't put to risk your health. And well, that's it.
Thank you so much, ma'am. It was so nice talking to you. Thank you so much for being on the set.
Thank you.